Dr. O, Advanced Physical Therapy and Wellness. Dr. Myro, our other rockstar PT. So we're gonna do some flossing of the wrist, and like literally, I've done this with up and handstand. I had Jen do it on me. We'll have to put that video in sometime. But so typically the floss is only gonna work on some sort of rotational glide. Like I previously mentioned with the elbow, working on medial or lateral glides. Same with the wrist. You're not going to do too good with like the lateral and medial glides of that wrist joint with the flossing that I can really think of. More so like a dorsal glide of the ulna or a palmar glide of the ulna, or vice versa with the radius. You can always do kind of opposing. But let's say we're going to do dorsal glide. Let's say we got pain with wrist flexion, and then we do like a dorsal glide and a palmar glide of so a dorsal glide of the ulna, palmar glide of the radius, and that decreases the pain. We're able to go a little bit further into wrist flexion. Cool. So since we want the dorsal glide, then we're going to want a rotation to occur this direction. So rotating this direction, rotating that direction. So we'll just kind of get the floss in that direction, and then putting like 50% stretch on it. The cool thing about this, if you have a short enough arm, you could always work the elbow and work the wrist at the same time if you're noticing that there's deficits in both. That's cool. Alright, so like we said, we wanted the dorsal glide of the ulna, so then basically that's what we're going to do. Let's say he was having issues in the wrist flexion, but first I'm just going to kind of work on it a little bit. Just going to kind of give that little Indian burn, maybe 10, 20 times. And then maybe I'll make it a little more functional. We'll come in through here, and then I'll go in through there. I'll rotate, go in through there, rotate, go in through there. Or even two, let's say he's having issues with coming into wrist extension, so he can even be up on the table coming in through here, and then I can rotate and you come into wrist extension, rotate, wrist extension. So let's say we do it like this. There you go. So essentially we could rotate, wrist extension. Good, come back, and then rotate, wrist extension. So you can make it a little bit more functional that way too.